Namaskar viewers. Today's series, or rather today's episode, is a continuation of our health quotient series. And on and off, we come across the discussion about fracture, fall, bone injuries, and likewise plaster and many other such things. Uh, Orthopedics is one of the vital branch of our life because from the childhood to adulthood to old age, we come across some or the other concern and issues, and what exactly it causes other than the fall, and how it is dangerous or kind of a precautionary measures required for us to keep ourselves active all through, and also the treatment course and many other terminologies which we are not aware of. To discuss all this and to understand the nitty-gritty of this topic, I have invited Dr. Ram Mohan from Hyderabad. Doctor is a senior orthopedics, and I have heard lots about him. That he is a very generous and service-oriented person. So, Doctor, thank you for your time and being on my show.
Good afternoon, Andy.
Uh, Doctor, as I said, all of us, have some or the other bone-related issue. This particular element is such that by and large everybody faces it at certain stage of life.
Yes.
So what I want to understand from you is, what are the common disorders we see when it comes to orthopedic?
Okay. Uh, it's a very general topic, but to put it in a few components,
Yes, sir.
the commonest problems we come across are neck pain and low back pain. Number one.
Yep.
The second thing is joint pains like the knee, shoulder, and the hip.
Mm.
And the third thing is fractures.
Yes.
And finally, the fourth one is genetic and hereditary joint problems. So these are the four components in orthopedics which we generally deal with.
Okay.
Okay.
All right. Doctor, the I will take the last question first.
Yes.
Many elders
Yes.
face this issue very commonly.
Yes.
The hip replacement, knee replacement, these are all age-related factors.
Yes.
I know very well that you cannot ignore it, but how to delay it and what precautions somebody should take from the beginning.
It's very relevant to our society in India, especially. Now, let me come with aging population first.
Yes, sir.
Now, I moved to UK from UK to India 11 years ago.
Okay.
If you look at the UK patients population,
Hmm.
the hip replacement to knee replacement is around 50 to 50 ratio.
Okay.
But in India, it is more than 90% knee problems as related to hip problem. So one has to keep this in mind and start analyzing why it is so huge
Hmm.
a disease in India.
Hmm.
Now, it is the lifestyle,
Yes, sir.
the diet, the diet issues, the exercises, the fitness. There are many factors involved.
Hmm.
Now, the knee problem in India is more in women.
Hmm.
For every 100 patients I operate on,
Hmm.
more than 80 to 85% are women.
Oh, oh, oh.
And they are in the younger age population as compared to men between 45 and 55.
Oh my goodness.
Whereas Indian men is usually above 60 years of age.
Okay.
So it's a very wide age gap,
True.
and also the gender relation.
Hmm.
80 to 90% in women is pretty big.
Hmm.
So when you look at it,
Hmm.
the Indian woman traditionally
Hmm.
they neglect their health
Hmm. That's true.
from marriage till retirement.
Absolutely.
They are working all the time.
Yes.
Their day starts with working. The
Yes.
breakfast is around 10, 11 o'clock. The lunch is at 3:30, 4 o'clock. And the dinner is at 11 o'clock.
Hmm.
See, the nutrition plays a big role,
Yes.
right?
Hmm.
And what do they eat? They eat what is left over.
Leftover.
right? So
Mm.
they are deficient in vitamins,
Mm.
in minerals, and in protein,
Protein, yes.
right?
Mm.
Secondly, the fitness programs, they are housebound, most of them. Yes, of course, the new generation of Indian women, they are going out,
Mm.
but that's a different, what you take now, 50, 60 years of age, most of them are housewives.
Yes, yes.
So they are limited to home, and with the modern lifestyle, most of them are in flats. There is no exposure to sunlight.
True. Vitamin D is deficient.
Vitamin D deficiencies, which causes osteomalacia.
Correct.
Another factor in Indian population, which I've seen very often, is hysterectomy at a very early age.
Mm.
Removal of uterus is such a
Mm.
common surgical
Mm.
procedure.
Mm.
For every 10 women I operate on, at least 7 to 8 women have had their uterus removed in their 30s.
Ah,
So these are the factors which are, I think, are playing a big role
absolutely.
in the development of osteoarthritis in women with no injuries, no infection, no hereditary factors involved at
Correct.
all. And early menopause
Mm.
is seen in Indian women. Also, when they reach in their 40s and 50s, most of them are becoming religious. So they start fasting and they give up protein diet. Those who are eating no mutton, meat, and all, they give that up in the name of religion, in the name of God. So when menopause sets in a woman, there is no hormonal support,
Mm.
no estrogen, no progesterone.
Mm. Mm.
Estrogen is the main defense factor
Correct. That protects them.
for women.
Correct.
Once that's gone,
Yes.
the muscles and the bones start getting osteoporotic,
Absolutely.
and there are fatty changes in the muscle.
Mm.
So at the time when they need to double their protein diet, they are cutting it down. So without knowing,
Mm.
they are causing harm to themselves.
Correct.
I feel these are the main factors why Indian women are suffering with such bad osteoarthritis in the knees at an early age. Okay.
That's a very, very important data you shared, doctor, and very good observation. Unfortunately, Indian women are very ignorant about their health, and family also do not take that much of interest in their health.
Yeah.
It's like taken for granted kind of approach. True. Now that you have said it, um, what is the difference between arthritis and bursitis?
Okay. Arthritis per se is the joint disease.
Huh.
Now, there are different kinds of arthritis. From
Yes,
a surgeon's point of view, when I say
yes,
arthritis, it
yes.
is loss of joint cartilage,
Right.
reducing the joint space. So, this is arthritis for me as a surgeon.
Mm.
Okay.
Yes.
There are different spectrums of arthritis, like inflammatory arthritis, which includes rheumatoid arthritis, SLE, ankylosing spondylitis. That's a different spectrum, but that ends up in osteoarthritis anyway after cartilage destruction. Bursitis is got nothing to do with the joint.
Ah,
Bursa is a bag of fluid which is an interface between the muscle and the bone.
okay.
So bursa acts as a lubricant for smooth function of the tendon.
I see.
So when it gets inflamed, then it becomes bursitis.
So that is where people develop pain and some sort of swelling in that way.
Yes,
Okay. But that can subside on its own or
most of the times it subsides.
okay.
The common places where you get bursitis is the elbow joint,
Uh-huh.
what you call olecranon bursitis,
Mm.
around the hip joint,
Mm.
trochanteric bursitis, and at the knee joint, around the patellar tendon and the quadriceps. These are very simple problems which are treated with analgesics, anti-inflammatories, and physiotherapy.
Mm. Uh, I was about to ask you about osteoarthritis and rheumatoid, but you already mentioned that it is more in women, and the reason also we discussed in the beginning itself.
Yes.
Doctor, as you just now spoke, let us speak a little bit more on that topic. after menopause, women are prone to many complications. It's not only
Yes,
the bone density, but even the heart related, cardio related risk as well. They're at par with men for that purpose.
yes,
Um, what would you suggest them? Food is one part, definitely, protein rich intake and other caution, definitely. But any kind of supplements or any kind of medication, home medication, I may not say that everybody should go to doctor, but
yes,
something that they can do as a precautionary measure.
yeah, true. Now, as I said before, menopause starts setting in the 40s, early 40s,
Yes.
and becomes established by late 40s, early 50s.
Mm,
Now, it is like putting your money in a bank.
mm,
If you want your money, if you want your bones and muscles to be strong,
mm.
then you need to start a decade early, right? For good returns,
Absolutely.
right? So if the menopause is starting in the 40s,
Mm,
then you start working out in the 30s,
that is, yes.
right? So what can we do about it? There
Yes,
has to be a fundamental change in the way we eat our food.
correct.
We are addicted to sweets. We are addicted to white rice,
Mm,
right?
mm,
And less of protein.
mm,
You know,
mm,
we don't like to eat eggs much.
mm,
Soya,
mm. Yes,
rajma,
yes, yes,
paneer,
yes,
and millets.
yes, yes,
Millets used to be the food of the poor people, of the poor farmers.
yes.
But if you look around now, all organic shops, they are promoting millets as healthy food
And at a very costly rate.
at a very inexpensive price. Yes. So our health, if it needs to be good, if the bones need to be good for women, then they have to start changing their diet.
Mm,
Number one.
mm,
And the second thing is you have to be aware whether you are getting enough sunlight or not.
mm,
There is no point in wearing full clothes and sitting out in the sun. The
mm,
sunlight has to be on the bare skin,
mm, mm, mm,
right?
mm,
So if you're not getting exposed to sunlight,
mm,
then you need to take vitamin D supplements regularly. Okay. The average dose is around 2000 units per day.
mm,
Either you take 2000 units per day
mm.
or you can start with a high dose. They are available in the market, 60,000 units. Take it once a week for 6 to 8 weeks, but then don't stop it.
Okay,
Continue it every month.
okay.
Most of the times, the patients come and say, Doc, I've taken my vitamin D. When did you last take? 6 months ago. I finished my regime. It is not like that. The half life of vitamin D is around 5 to 6 weeks.
Okay,
So, if you take today, after 5 to 6 weeks, the effect is not there.
right.
If the vitamin D is not there, calcium absorption is not
Will not happen, yes.
there. Right? That's the number one
Mm.
for vitamin supplements. And the second thing is B12 supplements.
Okay.
Vegetarians, they have to be very careful.
Mm,
B12 is usually the normal sources are non-vegetarian food. So if person does not like non-vegetarian food, it's by choice, then
mm,
they need to take B12 supplements. So once in a while, getting B12 levels done won't harm.
mm.
If the levels even are too high, B12 does not cause any toxic effects. So one should not worry about it. And micronutrients like manganese, magnesium, zinc, we need to be very careful. Otherwise, we will get general body pains, osteoporosis, right?
Yes. The general discomfort, energy, a
Yes,
lot of laziness, yes. Doctor, are, can arthritis cause heart attack also?
arthritis per se will not cause heart attacks,
Mm,
but
mm,
the pain from arthritis
mm,
can cause restlessness,
mm,
depression,
mm,
lack of sleep,
mm.
and all these factors increases the risk of heart problems.
No, but what I'm trying to ask you, maybe I'm not able to ask you correctly.
Ye-
The bones around the heart, because
Yes,
they are also can be affected due to the arthritis. Will that
yes,
be
yeah. But no, heart attacks will not be caused by osteoporosis. No,
autopsy? Okay, fine.
no.
All right. Doctor, we also heard that there is a term called contusion and there is a treatment called RISE. So I want to understand what it is and what is the treatment course means.
Sorry, I didn't get the question.
The term called contusion.
Yeah, contusion. Yes.
Contusion.
Yeah.
So term called
Contusion.
contusion and there is a treatment called RICE.
Yes.
RIC.
Yes.
So please educate us on that.
Yeah. Contusion is as a result of injury.
Huh.
There is no major organic or organ damage.
Hmm.
There is no structural injury. It is a functional injury.
Okay.
Contusion means soft tissue injury which results in swelling.
Hmm.
So there is a collection of fluid.
Hmm.
The main treatment immediately after injury, as you mentioned, RICE is correct. RICE. R is for rest.
Hmm.
I is for ice.
Hmm. Oh,
C is compression.
okay.
And E is elevation.
Okay.
Okay.
Hmm.
So rest is important when there is an injury. So don't, especially athletes and all, if there is
Hmm.
an injury, take rest.
Hmm. Hmm.
Ice packs 2 to 3 times a day.
Hmm.
The important part in ice packs is don't keep the ice packs in one place for a long time because it causes ice burns.
Hmm.
So apply it for a minute, take it off. Reapply, take it off.
Okay.
For 15-20 minutes, 2 to 3 times a day. And compression, you can use chubby grip, you can use crepe bandage to prevent further swelling.
Fine.
And finally, E for elevation. Keep your limbs on a soft pillow, not too high. Just keep it elevated. That will reduce the swelling and it
Who
will
are
aid in healing.
okay, and who are more prone to have this kind of injury? The sports.
Contusion is a normal injury. Anybody can have it.
Oh,
It can
anybody.
happen at home. It can happen on the road. It can
Oh,
happen in a sports place.
I see. I see. I thought it is more for the uh, sports people.
No, no, not
Not
necessarily.
necessarily. Okay.
No, anyone can get it.
Okay. Okay. Also, anyone can get the fracture. That's
Yes,
such a
yes,
common thing in our life that from the childhood, I think myself would have undergone some 3 or 4 fracture events.
yes,
And what happens, doctor? One, we do not treat ourselves immediately
yes.
because of whatever reason.
Mm.
Second, the caste is another major discomfort. And then third, the kind of physiotherapy or the recuperation time we do not give to that particular area, and which
Yes, true.
leads to the pain after some time.
Yes.
Um, I want you to tell me that how can we take care of ourselves and do not experience the pain later.
Now, fractures is a very very big topic.
Hmm.
Now, the cause of fractures is obviously an injury. It can be a
Yes,
fall at home, it can be a road accident or a sports
yes,
injury.
yes, yes.
Now, people should realize that the fracture configurations are different.
Hmm.
Not all fractures need surgery,
No.
but at the same time,
Hmm.
some fractures need surgery which the patients ignore. So it is very important to get a proper assessment. If there is a fracture in the joint line, what you call articular fractures,
Hmm.
more often than not, they need surgeries.
Oh no. Hmm.
Intra-articular fractures, say the fracture in the hip joint,
Hmm.
or fracture of the shoulder joint,
Hmm.
fracture of the elbow joint,
Yes.
they need surgeries
Hmm.
very commonly because we need to restore the motion of the joint. So if the fracture heals in a wrong way, then that results in stiffness, deformity, and arthritis. Okay. Now, depending on the fracture and the age, the recuperation period, the time for healing is different. In kids, it's around 3 to 4 weeks, where in adults it is 6 weeks, and in the elderly it can be 8 to 10 weeks. So the instructions have to be followed properly.
Hmm.
Whether we fix it or whether we treat it with plaster,
Hmm.
sometimes weight bearing is not recommended. Once we see the fracture healing, then we recommend weight bearing. So the treatment plan has to be customized to every fracture and to the patient. Okay.
Invariably, will the fracture area cause any kind of discomfort after a certain age?
In general, no,
No. Okay.
not at all.
Not necessary. Okay. Uh,
As long as the fracture heals properly,
uh,
there is not a major problem locally around the fracture site.
okay.
But we do see patients complaining of stiffness,
Uh,
scar tenderness, a bit of
mm,
hard,
mm,
muscles and all. But they are not dangerous and they will not interfere with your day-to-day activities.
sure. Yes. Okay. Um, Doctor, another major concern in IT professionals,
Yes,
the spondylosis. Um, they cannot avoid working, so
yes,
that is not a practical solution.
yes,
Uh, what kind of advice will you give to such people who are glued to computer due to
yeah,
their professional pressure? I won't say it's by choice; they
yeah,
have to do it.
yes. Uh, let's come to spondylosis. Now,
Mm,
I have seen most of my colleagues, in the orthopedic circles and prescriptions coming from outside hospitals
mm,
mentioning spondylitis.
mm, mm, mm.
People in their 20s and 30s, they come with a cervical collar, they come
Yes,
with a back belt.
yes.
And when I ask them, why are you wearing this? They say, my doctor has said spondylitis and you have to wear it for life.
Mm.
Don't be under the impression that you got spondylitis in your 20s and 30s and sometimes even 40s. Spondylitis is a term we use when there are changes in the spine structure,
Okay.
when there is newborn formation called osteophytes, or when there is a change in the disc height, right? Or when there are arthritic changes in the joints of the spine.
Mm.
So, spondylitis has become a very loose term.
Ah,
It is generalized, and
yes,
it is not like that.
I see.
Okay? And this is what I see very commonly in IT professionals saying, Doc, I got spondylitis.
Yes.
It is not.
Okay,
What they have got is muscle spasms most of the times.
I see.
And the reason why they get muscle spasms is very simple. You're working for 14 to 16 hours.
Mm,
You're not taking your fluids properly. You're not eating your food properly.
mhm,
There is no exposure to sunlight. You're
mhm,
not taking any breaks in between.
mhm.
Sometimes people sit in the sofa or on the bed in a very awkward, abnormal
Awkward position.
positions.
Yes, yes.
So muscle spasms, soft tissue sprains are bound to happen. So my suggestion to anybody who uses computer is sit at a proper desk.
Mm,
Make sure your computer screen is at your eye level, not high, not low.
mm,
Protect your elbows, rest your elbows.
mm,
Keep your back straight
mm,
or use a chair which has got head support.
mm,
This is a must,
mm, mm,
not like the chair I am using.
mm,
It has to.
mm,
Just relax
mm,
and do your work. Every half an hour to 45 minutes, take a break.
mm.
Walk around, stretch yourself, have some fluids, come back and do your work. It won't cause much of a problem. But people forget, when they're involved in work, they get carried away. And that's where the problems start happening.
But doctor, this leads to some more complications. I tell you what, blurring of vision,
Yes.
uh, giddiness, some sort of a numbness in that region.
Yeah.
You mean to say it is all because of the muscle issue and nothing to do with the serious problem?
No, not at all. Most of the times, there is no serious issue at all.
Okay.
Yeah, all the symptoms which you mentioned,
Mm,
giddiness, vomiting
mm,
sensation, tiredness, pain radiating from the neck to the head,
mm.
there's nothing major at all. It
Okay.
is a stress of work
Mm-hmm.
and the screen. Our computers are so bright screens that
Yes.
itself is a major factor in causing giddiness. Yeah. So one should not worry about it. And don't wear a collar just because of you want to wear it or somebody has recommended it. There has to be a reason. No, neck collar and the back so,
Belt.
belt,
Yes,
lower back belt, lumbar
yes,
belt,
yes.
they do more harm than benefit. When you wear the
Say
neck
it
collar,
again.
yeah, they do. And the reason is when you wear a neck collar,
Yes, sir.
the collar is sending signals to the muscles around the neck
Mm.
saying, I am doing your job, you relax. So the muscles get wasted.
Oh, 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 oh.
Right? Oh, it's not a good thing.
Hmm.
So collar or belt, they are not long-term usage purposes. It is only for well-established spondylitic changes and especially while traveling long distances. But otherwise, no, don't use them. Okay?
You're right. Every alternate person I see with the
Yeah,
collar and all. Yes.
young people, they come
Young
with
people,
collars.
absolutely.
Don't, it's a bad thing. It causes significant muscle wasting. And when you remove the collar, the pain gets worse.
Yes, absolutely. Suddenly the support is gone, and then
It's
you feel,
gone, isn't it?
yes, yes, yes. Very important message. Very, very important message. Um, Doctor, I spoke to a neurologist this morning, and he mentioned one very important part. Uh,
Mhm.
he said that the nerves that circulate the blood to the most of the regions of body,
Mhm.
um, they do support muscles and bones as well.
Yeah,
And his word of caution to the patients was, or the people rather, was, um, do take up some exercise regular basis,
yes,
because that will improve your blood circulation and that will improve your general bone density as well. So
yes.
first I want you to address the thing that why do sportsmen, athletics, cycling, gymming people experience pain and lot of bone fracture and fall?
Okay. Now, in sports, athletes get injuries depending on the type of sport they play. Okay. Now, in cycling or swimming, there are no injuries. It won't cause any long-term damage.
Okay, got it.
The two exercises which I recommend to everyone for all ages is swimming,
Mhm.
which is good for your core spinal muscles and also good cardiovascular exercise.
Absolutely.
And the second exercise is cycling. These two sports will never cause any long term damage. Never ever. Okay. Now, coming to other sports, it's a part of life like basketball, football, volleyball. They are high velocity, weight bearing, torque, torsion movements. Those are the reasons it is more than a physiological force. So they are bound to get injuries, ligament injuries, muscle tears, fractures. So those sports, they have an inherent risk involved. So we cannot avoid that.
We can avoid that. Got it. And it is bound to happen because there is quite a abnormal and different kind of actions, postures involved
Yes,
into their sports. Understood.
it is athletes who play these sports,
Yes, sir.
they are not using physiological force, they are using very high abnormal forces.
Okay. Absolutely.
Even people think golf is safe, but Tiger Woods had more than 15 surgeries in his career for his spine and his knee.
True, true.
That is amount of force that goes when you
Okay.
twist your body,
Yes,
when you swing your arms.
yes. Mhm.
Okay.
Very true. Uh, Doctor, bones density is
Yes,
something which we are getting to know now.
yes,
Earlier, 40 years back, we didn't know this term, and
yes,
nobody was worried about this term. But
yes.
now, with the change in lifestyle and, as you say, lack of nutrition,
Mm,
is having this as a one kind of a test in our annual report. So,
yes.
I want to understand what it is and at by what age somebody should take it serious.
Okay. Now, BMD, bone mineral density, is a marker for bone strength or osteoporosis. When should we get it? And who are the people who are prone for
Potential,
osteoporosis?
yes, yes.
Now, you got men and women.
Hmm.
As we know, women are more prone,
Correct.
especially around menopause.
Yes.
That is the commonest form of osteoporosis. Now, In women, where else do we get osteoporosis?
Mm.
If they have early hysterectomy along with the ovaries, if they are removed,
Mm.
they are prone to osteoporosis in their early 40s. And in both the genders, diabetes,
Mm.
especially insulin dependent diabetes,
Mm. Mm.
thyroid problems,
Mm.
kidney problems, long term chronic kidney problems,
Mm.
they do cause osteoporosis.
Mm.
Now, in men,
Mm.
although the osteoporosis is low, lifestyle issues like smoking, alcohol, they reduce the calcium absorption, they reduce the protein absorption in your gut, and that causes osteoporosis. And very rarely, hormonal changes, if the testosterone,
Mm.
if the male reproductive organs are not producing testosterone,
Mm.
that is a major factor for osteoporosis in men. So one should keep aware of this. If a young person, if a young male has got repeated fractures,
Mm.
one should look into these hormonal issues.
I see.
So keeping these factors in mind, if a man is healthy, I usually don't recommend any BMD scan.
Mm-hmm.
But in women, I do recommend it from late 30s onwards.
Oh, my
If
God.
the BMD scan is normal, then I say repeat it every 2 years, especially if there's a family history of early menopause. It becomes very, very important. Now, there are other reasons for osteoporosis. One should keep this in mind, like long term steroids intake,
Mm.
patients who have had cancers
Mm-hmm.
and have taken chemotherapy
Mm-hmm.
and
Mm-hmm.
radiotherapy.
Mm.
So, these are the people who also need to get regular BMD scans. Okay.
Yes, makes sense.
Now,
And yes,
the BMD scan, there are many ways of doing it.
yes, sir.
You will get free BMD scans of the wrist and heel. They are not good.
Mm-hmm.
They are not accurate.
Mm-hmm. Mm-hmm.
So what we need to do is called DEXA scan, DEXA, DEXA scan for BMD. That tests the bone strength in the hip and the spine and gives a generalized report. Okay?
Okay. Why am I asking this question is yes, menopause is one major milestone, no doubt about it.
Yes.
Um, and by and large, every doctor I'm talking to, it boils down to the same discussion that smoking and alcohol and drug addiction is the
Yes.
culprit, and everyone has to keep that in check or rather avoid it. Uh,
Yes.
to not to visit the doctor early or even often for that
Yes. Yes.
doctor, there is another very common term we hear, ligament tissue tear,
Yeah.
and which is what uh, I think it is very easy to treat, or rather quick to heal. So I want to understand that how sensitive is this injury?
Okay. Now, ligament is, you can call it like a muscle.
Mm.
And it's a soft tissue
Mm.
which connects two bones.
Mm.
Muscle tendon is something which connects a muscle to the bone. So it is different. Ligament is different. Ligament is between two bones.
I see. Okay.
Okay. Now, ligaments are there near every joint. You got it in the shoulder, elbow, wrist, hip, and knee and ankle. Major joints. In the shoulder, when the ligament is gone, it results in dislocation of the shoulder,
Mm.
secondary to injury most of the times.
Mm.
Right?
Mm.
Similarly, in the elbow and the wrist, but they are rare.
Yeah, they're there.
In the hip, the ligament is not that important.
Mm.
The major joint which where the ligaments are important is the knee joint
Knee joint. Okay. And the ankle also for that.
and the ankle. So in the knee, the commonest ligament to tear is ACL, anterior cruciate ligament,
Okay.
which is inside the joint. Now, ligament injuries in the joint,
Sir.
especially the ACL, it never heals on its own. If it's a young person who wants an active lifestyle, then we recommend surgery. Now, in the past, even in UK where I worked for 14 years, there is a traditional way of teaching saying that you strengthen your muscles, then you can avoid surgery by 50%. I personally feel that's not true. Now the new data is coming in, which shows that if the ligament is not operated upon, if it is not reconstruction done, in 15 years' time, the risk of arthritis goes up by 50 to 70%.
Oh,
Whereas with surgery, the risk goes down to around to 20 to 25%.
okay.
So one has to be very aware of this, Without a ligament in the knee joint, you cannot go running, you cannot do sports, and there is abnormal mobility between the thigh bone and the leg bone. So this results in early arthritis. We all know we get arthritis in the 60s, but without a ligament, the arthritis will be in the late 40s and early 50s. So one decade of your life, active life, will be gone.
True.
So that's the reason why ligament injuries have to be assessed properly and taken care of. In the ankle, yes, you can treat it with rest, proper physiotherapy. Most of the times you don't need to operate. So shoulders and knees, they need surgeries. Hip and ankle, most of the times they don't.
You know, old people generally go through this fragile state of hip bone fracture
Yes,
due to the
yes,
fall. And how advisable is the surgery one? Of course, depending on all other parameters.
yes,
Second, is it really useful after a certain age? Because as it is, their mobility is restricted. So,
yes.
how do you want to address this?
Okay. Now, hip fractures in the elderly, they are common, as you said. Now, here we have to differentiate between intracapsular fracture and extracapsular fracture. Intracapsular is where the fracture is very, very close inside the joint. Extracapsular is just outside the joint. The differentiation is important because in intracapsular neck femur fractures, hip fractures, you cannot fix them. So it has to be replaced.
It has to be replaced. Okay.
Fixation failures are 100%. There's no point in fixing a soft bone inside the hip joint where the blood supply is not good. It is better to replace so that they can get on weight bearing straight away after surgery without any bed rest. Now, coming here again, I've seen the hip joint replacements being uncemented,
Mm,
which is not a good concept.
mm,
And I keep discussing this in various forums.
mm, mm,
Now, in the elderly people,
mm.
their bone strength is not good.
Yes,
There is no growth potential.
absolutely.
The bone cells, osteoblasts, are not good.
Good. Yes,
So, when you put an uncemented stem, the bone cells have to grow into the stem and stabilize it.
that won't happen in them.
That won't happen. So, I have seen patients come to me and say, I've got pain in the thigh.
Mm,
So, I know it is loose. So, we have replaced so many of them, revised them. So, this is one thing which I want everybody to be aware of saying if it is an elderly patient, if there's a hip fracture which is inside the capsule, hip replacement is necessary, but get in with a cemented hip replacement. The cement will stabilize the hip joint. Some surgeons will argue saying that cement causes heart problems, can cause heart attacks during surgery. As long as the anesthesia is good and you take proper precautions while putting the cement, heart problems should not happen during surgery. Okay. The second thing is extracapsular fractures. They need fixation. They don't need replacement.
mm, mm,
And of course, depending upon the type of fracture, we put in a nail
mm,
and sometimes we put in a plate depending on the configuration of the fractures.
yes.
After surgery, because it is a fixation, they need to be careful with weight bearing for 6 to 8 weeks.
Mm, mm.
And then they can walk normally.
My last question, doctor.
Yes.
Uh, they say that recovery rate at young age is faster than the old age for whatever reason, because if the strength, the growth is very favorable condition.
Yes.
However, we have seen children with lot of disorders when it comes to the structure, the walking inability, and many other challenges they are going through.
Hmm.
Um, Of course, we know the reasons also. Malnutrition, the birth related complications. There are reasons.
Yes.
However, what I want to understand from you is the the young generation.
Hmm.
They are very, especially with the modernization. Children are absolutely. I would not blame children. Parents are very oblivious to the nutrition value they are feeding to the kids.
Yes.
And this generation will be the future of any nation, any civilization for that matter.
Yes. Yeah.
And their health is primary and important. But in the course of modernization, we are feeding them all sort of junk, and that is causing a lot of damage very soon. As you said,
Yes.
20-25-year-old child is going through some sort of surgery,
Yeah.
early disorder, early challenges, fall, fracture. They are not able to, handle the weight at all.
Yeah.
What will be your advice to such people?
No, we have to go back to the basics. Simple.
Mm.
You know, there is no
No alternative.
quick fix. There is no quick fix.
Mm.
Now, in the Indian hotel industry,
Mm.
there is no regulation.
Absolutely.
There is no accountability. There
Correct.
is no responsibility.
Correct.
Now, people should investigate. They should know that, cooking stuff in oil is not bad,
Mm.
but the oil which the restaurants, the hotels use, it is on continuously.
Mm.
It is very
Temperature.
dangerous. It is what we call HVO,
Mm.
hydrogenated vegetable oil. You keep burning it again and again and again, the
Mm.
molecular structure of this oil changes.
Mm.
And this is one of the most important factors for causing heart attacks in the young population.
Yes.
Very, very high.
Yes.
Eating junk food is not bad, but there has to be a limit,
Mm.
and you need to know where you're getting your
Very
food
hard.
from.
Mm.
There are good restaurants, there's no doubt about it. But our industry, especially, you don't know whether it is vegetable oil, whether it is beef oil. It's so adulterated and contaminated.
Mm.
The other day in Bangalore or Kerala, one young woman died by eating chicken biryani,
Yes.
which she ordered on Swiggy.
Yes.
No, it should not happen.
Happen. Yes.
And the kids should be taught from childhood about the food habits,
Mm.
how to cook their food at home.
Mm.
They have to be educated.
Yes.
There is no point in teaching maths, physics, biology if you don't teach nutrition properly.
Life lessons.
So it's very, very important.
Mm.
So unless you start at home,
Mm.
I think it's a lost game already, to be honest.
Yes. Absolutely. It's a lost game. You have already left your train.
Yeah, the battle is lost.
What is lost? Absolutely. Thank you for your time and that word of caution. It was really helpful and enriching. Maybe we'll talk on other subject once again. Thank you for your time, Doctor. Namaste.
Thanks a lot, Mr. Sharma. Take care. Bye.
Take care.